guys, it's Olivia. Welcome back to your Endocrinology chapter. In this section, we'll be talking about the hypothalamus. The hypothalamus is going to be that organ that is important for the relay between the CNS and the endocrine system. We'll talk about the embryology and the function of the hypothalamus. Then we'll do a rapid review of the RAAS and ADH system, which will prepare us nicely when we talk about the syndrome of inappropriate ADH secretion. Of course, ADH is going to be produced by the hypothalamus, and we'll talk about the pathology, the presentation, and the treatment for the inappropriate secretion of ADH. We'll then talk about another ADH-related pathology, diabetes insipidus. And then finally, we'll talk about different causes of hyponatremia. It's oftentimes very difficult to evaluate different causes of hyponatremia, so it'll be great to cover that in this video. For now, though, let's get started talking about the hypothalamus. So the hypothalamus is going to be an incredibly important part of the endocrine system, but also part of the central nervous system. So highly likely that you'll get tested on this either under a neuro question or under an endocrine question. So great to be familiar for both of those reasons there. So first, where does our hypothalamus come from? Well, it comes from the forebrain. Well, if you remember over here, we have these three parts of our brain that evolved during embryology. We have the prosencephalon, or the forebrain. We have the mesencephalon, or the midbrain, or the rhombencephalon, the hindbrain. And for the purposes of this video, we'll talk about the prosencephalon because that is what is going to give rise to the telencephalon, and the telencephalon will in turn give rise to parts of the cortex, or those higher areas of your brain. And then the diencephalon, what we're concerned about here, the diencephalon is going to be that little part that is going to give rise to the thalamus and the hypothalamus. So we have our forebrain that gives rise to the diencephalon, which in turn gives rise to our hypothalamus. So why is our hypothalamus so important? Well, our hypothalamus is going to connect our central nervous system and our endocrine, like we already talked about. And it's kind of unique in that it is one of the very few parts of our brain that has part of it that sits outside the blood-brain barrier. So a lot of your brain sits kind of behind this blood-brain barrier in its ivory tower, and it does not communicate with circulation or the rest of the body. The hypothalamus, however, does, and that is going to allow it to have this really unique role in which it is monitoring the levels of different hormones in your circulation and is going to be able to respond in real time to those changes because it sits partially outside of the blood-brain barrier. This is going to allow our hypothalamus to perform its job of regulating thirst, hunger, temperature, sexual urges, and circadian rhythm really well and in real time. But how does our hypothalamus regulate all of these different complex body systems? Well, it primarily does so through the regulation of the release of different hormones from the anterior and posterior pituitary. So a lot of times when the hypothalamus shows up in our different hormonal pathways, you're going to see a direct line from the hypothalamus directly to the anterior and posterior pituitary. It's kind of the boss of the pituitary. And that's going to be one of its main functions, which you can see as we go through several of the different hormones that it secretes. So the first hormone we'll talk about is thyrotropin release hormone. If you look over here, thyrotropin releasing hormone is the first one on your diagram. And thyrotropin release hormone is going to go directly to the anterior pituitary and cause the release of thyroid stimulating hormone. This, of course, causes the thyroid to release T3 and T4, which will exert their effects throughout the body, controlling temperature, metabolic rates, have some potential changes on circadian rhythm, and exert all of those effects through that way. The next hormone we'll talk about is GnRH, or gonadotropin releasing hormone. So gonadotropin releasing hormone is also going to be released by the hypothalamus. It is going to again go directly to the anterior pituitary and this time stimulate the release of luteinizing hormone or follicle stimulating hormone. These hormones will then in turn cause the release of testosterone or estrogen, and testosterone and estrogen are going to be your sex hormones, right? So this is going to be how the hypothalamus is going to regulate sexual urges, some sexual development, and exert control over that pathway. Next, we'll talk about corticotropin releasing hormone. And corticotropin releasing hormone, again, no big surprise, is going to go directly to the anterior pituitary, cause the release of adrenocorticotropic hormone, which will then cause the adrenals to release cortisol. Cortisol is that fight or flight hormone, but it's also going to have some important effects on our hunger and metabolic systems as well. So a very important hormone that allows the hypothalamus to exert a lot of downstream effects through its control of this system. The next hormone that the hypothalamus really is responsible for is growth hormone releasing hormone, and growth hormone releasing hormone, no big surprises there, is going to go to the anterior pituitary once again, cause the release of growth hormone. Growth hormone will actually go to the liver and stimulate the release of insulin-like growth factor 1, which will in turn exert downstream effects and cause increased growth of our muscle cells, our bone cells, and our fat cells. Next, we'll talk about somatostatin, and somatostatin, or somatostopin as I like to call it, is going to be a hormone that is primarily essentially involved with shutting down different other hormonal pathways. So somatostatin is going to be an inhibitory hormone that is going to inhibit GI, endocrine, pancreatic, pituitary secretions, and shut down all of these processes that are important for digestion. So I like to call somatostatin somatostopin because whenever you see it, it's a great bet that somatostatin is going to be shutting down another hormone or shutting down another pathway. Next, we'll talk about dopamine. Dopamine is going to regulate movement, is going to be important for memory, reward motivation, so another important function of our hypothalamus there, that it secretes dopamine. Now, our last two hormones that we'll talk about are a little bit different in that they're actually secreted by the hypothalamus, but they are stored in the posterior pituitary. So oxytocin and ADH are both secreted by the hypothalamus, they're made by the hypothalamus, but they live in the posterior pituitary, and their release from the posterior pituitary is what is going to determine their concentration in circulation. So oxytocin is the first hormone that is made by the hypothalamus but stored in the posterior pituitary, and it is going to be responsible for contraction of the uterus during childbirth, as well as contraction of the mammary glands and the stimulation of lactation. So oxytocin, incredibly important for childbirth and for feeding infants, and it is going to be stored in the posterior pituitary. Similarly, antidiuretic hormone, or ADH, is going to be stored in the posterior pituitary but made by the hypothalamus, and ADH is going to be that hormone that's responsible for inserting more aquaporins into our distal convoluted tubule in the kidney, and the more aquaporins that we insert, the more water is reabsorbed from our urine, so it's going to be essential for our ability to really concentrate that urine when we need to. And that, of course, is going to play into your hypothalamus's ability to determine the water content in your body. So ADH is also sometimes called vasopressin. It's listed as vasopressin over here on your slide, so another important thing to be aware of. So we've talked about all of these different hormones and all of the different jobs the hypothalamus has, but where the heck do all of these hormones come from? Well, there's specialized areas, specialized nuclei in the hypothalamus that are responsible for secreting all of these hormones, and it is going to be pretty high yield for you to be familiar with the different nuclei in case you get asked about them on step 1. So first, let's talk about our suprachiasmatic nucleus. And our suprachiasmatic nucleus, located over here on your diagram, is going to be important for regulating sleep. So our suprachiasmatic nucleus is going to secrete norepinephrine, and this norepinephrine is going to stimulate our pineal gland. If you can see our pineal gland over here, it's this pea-sized gland located on the posterior aspect of our third ventricle, and the pineal gland secretes melatonin, which of course is going to help regulate our sleep-wake cycle. This melatonin is what's going to make you sleepy. It's sold in a lot of supplement stores. It's become very popular lately as a sleep aid, but this is your body's natural way to regulate sleep. And because our suprachiasmatic nucleus is so involved with sleep regulation, you can imagine that if it's damaged, this might lead to a pathology like insomnia, dysregulation of sleep. So good to keep that in mind as they might ask you about what happens when it's broken on step 1. Our next nuclei that we'll talk about is going to be our supraoptic nucleus. And our supraoptic nucleus, if you look right over here, is going to be responsible for synthesizing oxytocin and ADH, and they're going to be in part synthesized by our supraoptic nucleus. Our paraventricular nucleus, located right over here on your diagram, is also going to be partially responsible for producing oxytocin and ADH, but as opposed to our supraoptic nucleus, which just produces oxytocin and ADH, our paraventricular nucleus has a few additional roles as well, and is going to produce TRH, CRH, and somatostatin as well. So all of these hormones that we've talked about up here, TRH, CRH, somatostatin, ADH, and oxytocin, are going to be partially synthesized by your paraventricular nucleus. Next, we'll talk about your lateral nucleus, and your lateral nucleus actually is not imaged on your diagram. However, it is going to be important for regulating hunger. So if our lateral nucleus was damaged, you might have something like aphasia, you might have aversion to food and not be able to eat. So important to keep that one in mind as well, as it might show up in a board's question. The next one we'll talk about is our ventromedial nucleus. So if you look right over here, you have your ventromedial nucleus kind of on the posterior aspect of your hypothalamus, and this is going to be responsible for satiety. So our lateral nucleus was responsible for hunger, and if we didn't have it, we might experience aphasia, but our ventromedial nucleus is going to be responsible for satiety. So if this is damaged, you might have a person that never feels full and continues to eat and eat and eat and eat. This sounds a lot like Prader-Willi syndrome, but I do want to clarify that there is actually more evidence to indicate damage to the paraventricular nucleus in Prader-Willi syndrome, so just a point of clarification there. Next, let's talk about our anterior nucleus. And our anterior nucleus, if you look over here, it is located very anterior on your hypothalamus, and it's going to be responsible for cooling. And it exerts its cooling effects through parasympathetic innervation, which will be important as a contrast to our posterior nucleus. nucleus, which exerts its heating effects through sympathetic innervation. I always think about calming and cooling through the anterior nucleus, which is parasympathetic, and then when you're really ramping up through that sympathetic innervation, that's where you'll get your heating response. So of course, if your anterior nucleus was damaged and you weren't able to exert cooling effects on your body, you might get some hyperthermia, inability to cool down. Whereas in contrast, your posterior nucleus, that one that is responsible for heating through the sympathetic innervation, if that one was broken, you might have an inability to heat up. So you might get hypothermia. The next nuclei that we'll talk about is the preoptic nuclei. And if you look over here, we have a medial preoptic nuclei and a lateral preoptic nuclei. I don't think it's incredibly important that you are able to differentiate between these two. I think it's pretty low yield, but our preoptic nuclei themselves are important because they produce GnRH, and they're also involved with thermoregulation and sleep regulation. So they have a diversity of functions here, and they're also most likely the primary site for GnRH creation within our hypothalamus. Next, we'll talk about our arcuate nucleus. And our arcuate nucleus, if you look right down here, is going to be responsible for mediating our metabolic signals like leptin, ghrelin, and insulin. It's kind of this relay pathway in your hypothalamus where it's getting all this information about the metabolism in your body and kind of synthesizing it and then spitting it out in a usable form. Next, we'll talk about your dorsomedial nucleus. Your dorsomedial nucleus is going to be located right up here. And your dorsomedial nucleus is responsible for a lot of your feeding, drinking, body weight, and circadian rhythms. So it's got a lot going on. It's kind of involved with almost all of the key functions of the hypothalamus, so definitely an important one to be aware of. And then finally, we will talk about your mammillary bodies. And your mammillary bodies are located right back here on the posterior aspect of your hypothalamus. And the mammillary bodies are going to be incredibly important because they're part of the limbic system. So they're involved in memory. They relay information from your amygdala and from your hippocampus to the thalamus. So they're going to be important for recollective memory. And they're actually going to be the part of your brain that's damaged in Wernicke-Korsakoff syndrome. So if you have that B1 deficiency, that thiamine deficiency that is common in alcoholics, you're going to be damaging your mammillary bodies right here. So that was a lot of information. What are the key takeaways from this video? A couple of things that I want you to remember about the hypothalamus after watching this video is, number one, the embryology. It derives from the forebrain and then from the diencephalon. That is a classic question that always comes up on STEP. Where do things come from? So that's a great takeaway from this video. Next, I want you to remember that the hypothalamus is our important relay point between the CNS and the endocrine system, and that is because part of it is outside the blood-brain barrier, which is an essential anatomical aspect of the hypothalamus, which allows it to perform this role. Next, I want you to remember the key functions of the hypothalamus. So think about regulating thirst, hunger, temperature, sexual urges, and circadian rhythm throughout our body. And remember that the hypothalamus does this largely through its control of the anterior and posterior pituitary. And then all of the nuclei that we talked about, it is a lot of memorization, unfortunately, but it is likely that these do come up on STEP, so I would highly recommend reviewing this before taking step 1.